First of all, a very good afternoon and namaste to you all. And I'm very much thankful to TEDxIOM team for giving me this wonderful opportunity to be part of this exciting platform. Born in one of the foothills of the remotest village of far western Nepal, I was brought to Kathmandu at a very young, small age by my relatives for my education. I went to a very good boarding school in Kathmandu from nursery to class 10, but having grown up without the care of my mother's love, I can say I didn't have the best of my childhood. Following that, I completed my ISC, that's equivalent to 10 plus 2 these days. And with the dream to become a doctor, I went to BPKIHS as a medical student. And after graduating medicine, I did my MS in general surgery and subsequently MCS in surgical gastroenterology from TUTH MMC IOM. Following this, I had a desire to become a HPB and a liver transplant surgeon. So accordingly, I got trained in Melbourne for 2 years and I got a scholarship. And in 2015, I've been working as a GI, HPB, and liver transplant surgeon. During this academic, my journey, there are a few instances that I would like to share. The foremost, during my 10 plus 2, the ISC examination, I was good at my studies, but I could not perform well in my final exams. I had a dream to become a doctor, but because I didn't perform well in my exams, so I was convinced by my relatives to join Nepalese army. I didn't want to, that was not my interest. But finally I had to agree and then I attempted going into Nepalese army, becoming a military officer. I went through a series of examinations, but finally I failed. Actually, I used that time, that opportunity, as an opportunity to again prepare for my medical examination. But when I felt very disheartened. I felt that I could not do it. But interestingly, 30 years after I failed in the military exam, I was able to receive an appreciation and acknowledgement from the Chief of Nepalese Army because of all the dates, all the work that I've done, and all the contributions that I've made. After my MBBS, I worked in pediatrics and I developed a severe interest in becoming a child specialist. I wanted to become a pediatrician at any cost. But unfortunately, because of my number in the merit list, I could not. So by default, I had to choose surgery in IOM. I had to become a surgeon. I was a bit apprehensive at the time, but one thing that I have inside me is a determination. No matter what I get, I use that opportunity with the best of my efforts and try to produce the best outcomes. 21 years later, when I joined surgery as a resident in 2003, in 2024, I led the team who performed country's first successful independent living donor liver transplant. My interest in liver transplant surgery, actually, I started dreaming about it back in 2009 when I was working as a member of one of the surgeons in Department of Surgery. I was working in GI surgical units, and I had already developed an interest in hepatobiliary and pancreatic surgery. My seniors were already doing a good amount of liver and pancreatic surgery work at the time, but I found there was so much of room to improve, in terms of complexities and volume. I thought I could make a good career in becoming an HPB surgeon in TUTS. So accordingly, I started looking for opportunities overseas, and I applied many places, and I got accepted in few places. But I chose going to Australia, Melbourne. When I was accepted, they had a phone interview. They took a phone interview, and I was asked why I am interested to coming to Melbourne for training. I said, because I'm interested in the HPB surgery, I want to become an HPB surgeon. But more than that, I want to dream about starting a liver transplant program in Nepal in future. It sounded very impractical at that time. It sounded very unrealistic dream. But actually, I think that was what they made, I could impress them. I was selected and I went there. In 2010-11, I did 1 year of HPB training. And during that time, I had a chance to visit a transplant center in Australia, in Melbourne, and where I could understand about liver transplant, I read about the feasibility and possibility of setting up that things in Nepal. I came back and spent a few years about how I could dream about starting, how could I work on, whether it was feasible or not. I found that we had a significant number of patients with us who would benefit by liver transplant, and we're losing all the patients, as many of them, those who could afford, were going to overseas, mostly to India, getting their liver transplanted at a very high cost. So I thought I had to do something on this matter. I had to work on it. I started sharing my dreams with my colleagues. Some of them who were close to me trusted on me, but many of them laughed and said I'm just talking about something very unrealistic things. So I decided to go back again to train myself for liver transplant. In 2014, I went back in Australia, Victoria, where I got my liver transplant training. And 2015, January, I came back, and that's when actually all the struggles started. I was the only person trained in liver transplant in my institute. So in the next 3 to 4 years' time, I spent building up team. I started convincing all my colleagues to be part of our liver transplant team. So gradually, I was trying to convince people from different specialities. I was being able to make team, although many were very skeptical about it. Many were somewhere even actually against it, that this is not the right thing to do. This is not feasible in Nepal or in our hospital. But I didn't listen to them. I kept forward moving. My dream was slowly becoming dream of many of my colleagues. Actually, we were also able to convince the Ministry of Health. And we received a good amount of money, which was required to uplift the services that we had in the teaching hospital. We had to purchase very expensive instruments for surgery, for anesthesia. So we were able to convince with our plannings, with our proposal. We were able to convince the ministry, and we received good amount of money, and with which we were able to build up ICU team. We could purchase all the surgical instruments necessary for liver transplant and all the anesthetic complicated machines. So almost 4 years it took us to prepare ourselves for starting the liver transplant program. And finally, we were able to receive the license from the government. And it was in 2019, May 31st, we did our first liver transplant in TUTH Teaching Hospital. And that was with the help of our Indian colleagues from Apollo Hospital. And that was the first one we did. It was done after 11 years of starting kidney transplant in TUTH Teaching Hospital. It was a milestone. It was a big thing that happened in the hospital. We all were very encouraged. But it took us very slow. In the next 5 years' time, we only did 10 transplants, and that too with all the help and supports from the Indian colleagues. And there was a lot of questioning now. Now, how long are we going to do like this? How long are we getting the help and support from our Indian colleagues? So there was a question why we can't do it on our own. So I sat down with my team and we started discussing that I think it's a time for us to now take over ourselves completely. I had a trust on my team, and I had to be sure that my team had trust on me as well as a leader. So everyone had a very positive thinking. So we all decided, I think we should move forward and we should start doing on our own. So accordingly, it was in January 12 last year, 2024, we made this dream come true. The country's first independent, successful liver transplant procedure was done. A procedure which was thought as one of the most complicated and difficult procedure, also a very expensive procedure, which once thought was not possible or feasible or unrealistic dream. It happened. We made it true. Both the patient and the donor were discharged on time. And following this, we got a lot of appreciations from everybody. The Prime Minister called me, the past permanent Prime Ministers, they all sent me a good the appreciation messages. I got phone calls from even our international friends from India, from Australia, where I was trained. And they all congratulated us and wished best wishes for moving ahead. It was a dream come true. And I think I should take this opportunity to thank each and everyone who have been part of this liver transplant program, who have been part of this history making, not only those who are part of a team inside the hospital, but there are many members outside hospital, starting from ministry to our medical council to many other places. So a lot of people have been involved. Many people have put their efforts and making this dream come true. So from last year to yesterday, so yesterday we did our 20th living donor liver transplants. And this is the 11th independent living donor liver transplants that has happened in the country. And currently, I feel proud to say that we are the only team who are doing, in Nepal, who are doing this living donor liver transplant independently. So the journey of liver transplant has been tough. It has not been easy. There are a lot of obstacles, setbacks, difficulties. But I myself and my team have been able to move through it, confronted it, and we have been very resilient, and we have, time and again, we had difficulties, but we have risen above these difficulties, and we have been able to come up to this stage. And at this moment, I can say that the liver transplant program is going to be a well-established program in Teaching Hospital, and will be a leading institution in terms of liver transplant for a whole nation. Now, when I look back 21 years back, 2003, when I didn't want to become a surgeon, now coming to this stage, leading the country's only one independent living donor liver transplants, I feel proud, and I cherish each and every moment of becoming a surgeon. And besides this, I think I'm very happy and content when I find myself being able to help and serve the needy, our Nepalese people, general people who need complex GI, HPB, and other surgical procedures. Besides that, I feel very privileged. So at times, I've been also been helpful to even a very high-ranking peoples like Prime Minister, the presidents, vice presidents, and different ministers at times. Besides that, and currently I'm heading the Department of Surgical Gastroenterology, which is one of the youngest department in the whole institutions. And for your information, I can tell you that in these 4 years of our becoming a new department, we are one of the largest tertiary levels referral center in terms of managing complex gastrointestinal, liver, and pancreatic surgical diseases, both cancer and non-cancer related diseases. Now, my becoming of a surgeon, although as I said, this was not my dream, but which I became by default, I will always cherish and celebrate becoming a surgeon and also becoming a liver transplant surgeon. Besides my surgical academic career, I think I'm very fond of sports, music, and sports, especially football, marathon runnings. And I have a good football team, like my good transplant team. I have a good football team, and it's a very strong team actually. And I still keep participating in various these running, 10K, 20K marathons. Besides that, I'm very fond of music. I'm not a very professional singer, but I do sing, write, and compose songs. If you are interested, you can go to my YouTube and find 11 of my original songs. Having this kind of passions, this kind of extra, professional activities, I found myself, they're so helpful. It gives me energy. It always keeps me very lively, if you have noticed that. And I'm always very, ready to go. And the advantage of these extracurricular activities have helped me to actually perform well in my professional career as well. One of the greatest satisfaction I find is whenever I meet my juniors, my junior colleagues, my residents, and my students, when they meet me and say, "Sir, we are so inspired by you." And that moment, I get inspired myself to inspire many others. So this has been the journey. Before I wind up, I would like to say to all of you that no dream is a big dream. We all deserve to dream big. But while we dream, we need to have a clear vision, a clear path, how we are going to fulfill that. Just having a dream doesn't mean anything. So you need to have a clear path, a clear vision, how you're gonna move ahead. And with a lot of hard work, perseverance, and you should be resilient, you should be ready to, fall and rise again and again. And you should be ready to confront so many obstacles, difficulties on the way. But if your heart is clean, your mind is good, God is always there to help you, because God helps them who deserve it. Thank you.